Hi, everybody. It's time. 4:30 is the time, and the day, of course, is Hump Day. It's Wednesday, and we have a wonderful guest. Tora will be introducing him momentarily. Just stay tuned.
Check this.
Yes, indeed, we are live. It's 4:30. Good morning, good afternoon, good evening. No matter where you are in the world, you can be watching live right now. We broadcast on Facebook and YouTube. So we hope that you're watching. We hope you're enjoying yourself. Don't forget to like and share. All right? Don't forget to do that. First thing I'm going to do, though, is bring on this superstar of mine, Mr. Billy Riley. And then we're going to get to our guest, okay? Billy Bob!
What's up, brother?
How are you, Ramrod? How are you, sir?
I'm telling you what.
Get some
I'm priming up for tonight.
drink.
It's going to be amazing.
We're going to have a great show tonight, man.
It's
We're having a great show
unbelievable.
right now. I've got a great guest, so you're going to watch, right?
Yeah, I'm going to watch.
Yeah. Okay, so it'll be a good show. And you know what? At the end of the show, come back in. We'll talk a little bit more about tonight,
Good.
okay?
Hey, listen, you have a great show, Lee. I can't wait till tonight. We're on to something. I'm excited about the topic, and
Indeed.
everybody's fired up.
Yes, sir. All right, man. Thank you, buddy. Appreciate it. Tora Arsala, there he is, wearing his red. I love it. I love it.
Please tell me he's not at my favorite bar.
He might be. I don't think so, though. I don't think he's a patriot.
So today we have a very special guest joining us. He's an epidemiologist with the Fairfax County Health Department. I'm very excited to have him come on the show to talk about what's going on in the community and how COVID's going.
All right, there he is, ladies and gentlemen, Dr.
Hey,
Najera.
how are you guys?
Renee, how are you?
I'm all right, all things considered.
All things considered, right. All right, Tora, thank you so much, my friend. I appreciate you. Okay, so Renee, talk to me a little bit about, well, first, what's an epidemiologist? I know, but I'll let you explain it.
That's a good question. A lot of people think that it has something to do with skin, but no.
Yeah, epidermatologist.
No, so epi, it means upon or above. Demi, it's demos is people, and then ologist is study. So we study the things that come upon the people. So we study diseases. We study infectious diseases, social determinants of health, chronic diseases, anything that affects people, we study it.
Cool. So that's cool. So you are a doctor that studies infectious disease, chronic disease, different things, and why they happen to the human body.
Suicide, drug abuse, violence, all
everything.
That stuff. We try to understand it, and we try to advise people who make policy to make the best policy possible.
There you go. Talk to me about COVID. Tell me how you guys have been working to tell people more about that. I am under the impression that this looks like, even though there's supposedly been a reoccurrence, it seems to me that the reoccurrence is a lot of it, not all of it, of course. I'm not trying to dissuade or say there's no such thing as COVID. Absolutely not. I had a very good friend and his whole family got infected, and luckily they got through it. And it was horrible. It was like a really, really bad flu, maybe even worse than a really, really bad flu. But they were all pretty healthy going into it. So that was, that obviously that helps, right?
Yeah.
So go ahead.
We had here in Fairfax in the DC metro area, we had our peak back in late to mid-May, or mid to late May. We had quite a number of cases, unfortunately, about 500 or so deaths. We're up to 16,000 cases total. So, you do the math, it's a little bit more deadly than the flu. Many of those cases were in nursing homes, unfortunately. So, people in the community who have folks in nursing homes, they went in to visit their relatives or staff members who live out in the community. They went in to take care of these folks, and they brought it in. And they brought it into groups of people who are, not as healthy as the regular average person. And they got sick. And unfortunately, many of them unfortunately passed away. But right now we're here in this area. We're in a lull. We're just cruising 70 to 100 cases per day, which is still a lot, but it's not as many as we had at the peak. Certainly other parts of the country. Yeah, exactly. Yeah, I got mine here. I got a Batman one. I have a Superman one. Certainly other parts of the country are experiencing what we experienced back in May. And they're not doing so well. So Florida, Texas, Arizona, California, they're having a rough time of it. And within those places, people who are low socioeconomic status, who tend to be also minorities, are not having not doing well at all. They're having higher rates of death, higher rates of complications. And you're seeing it more and more now in the younger people. We used to think that younger people would be somewhat protected of this. As they went back to school and they went back to mixing with each other, we found out that that's not the case. They're also catching it. They're spreading it. They might not get as sick because they're a little bit younger, a little bit healthier, but they're passing it on, man. And it's a tragedy what's happening in some of those places.
Let me ask you about the testing. Okay, so obviously there's a lot more testing, therefore kind of goes that there's going to be a lot more positives. I imagine there's also a lot more negatives than there were before because there's more testing. Now, my question is, the people who are asymptomatic, how many of the positive tests, and you may not know this numbers, but how many of the new positive tests are asymptomatic, which is dangerous to other people, but not to themselves per se? How many, where does it lie? How many people are getting sick and how many people are asymptomatic?
So it's between 20% and 40% asymptomatic.
Okay.
And that is more because when we identify a case, we interview them and we see who their contacts are. And we recommend to those contacts to go get tested. And so that is expanding the pool of people that are getting tested asymptomatically. It's also expanding the pool of people that are getting tested in general. So one of the things is, you're doing more testing, so you're catching more cases, and that's what's leading to the rise. No, we look at the percent positive. When that percent positive hovers around 5 to 10%, like we're seeing right now, it's not because of our testing. It's because that's about the level of transmission that's going on.
Right.
When that is lower than that, then that means that we're doing a lot of testing. We're catching a lot of negatives. We're doing it very broadly. When it's above that, in the 15 to 20% positive range, then we're being very selective in our testing. And that's what we had when we didn't have enough lab tests back in May.
Okay, so we have a higher number, but we have a lower percentage.
Yeah.
Is that what it is? It's a higher number because of more tests, but it's a lower position because of more tests.
Yeah.
But the more people, the smaller the amount that get it. I understand how that works.
And in places like Florida, you have a positive percentage rate that it's still elevated. And so that is not explained by more testing. That is just explained by more transmission.
Well, and I would suggest that some of the numbers are higher in Florida, Texas, Arizona, and California. I don't know what the death rates are, but the death rates might be higher because we have the elderly, more elderly live in those states. I think more so than other states. Lots more in Florida. California just has a huge population. So
yeah.
Texas, same big, huge population centers like, Austin and Dallas and Houston and Corpus Christi. Well, not so much Corpus Christi, but they did have it when they had the spring break because Corpus Christi got overrun during spring break. And that was an issue. I went down to Ocean City, but I stayed in my hotel most of the whole time, except for later in the evening when I could circumnavigate and go get myself some, hot nuts and some French fries or something.
And you were wearing your mask, right?
Absolutely.
Yeah, so that's one of the things. Like, you have these groups of people coming together, and they're on top of that, they're not wearing masks.
Right.
So that's just a combination for all this to explode.
Yeah, I watch baseball too. And I see these guys playing. I'm going, why can't you play baseball with a mask? I mean, they're not wearing masks, but I'm like,
yeah,
you can wear a mask and play baseball. What the world? It drives me crazy. Football, any sport. There's not one sport except watermelon seed spitting that you can't do without a mask. With a mask. So I don't know. I haven't been able to figure that one out watching so far. But all these colleges are shutting down football, and my suggestion would have been from the very beginning, the boys just have to wear their masks when they're around the other guys. Even in practice and whatever.
The thing is that it's not so much what they're doing during the game or around the game. It's what they're doing outside of the game.
Uh-huh.
So for that, you need to bring them together in some way. And they do. They live in the same place. They travel together or whatever. And so that's when you have the breakdown in some of these infection prevention practices.
Yeah. I mean, like, for instance, I know, for instance, myself, I'm very high risk. I've been wearing a mask for over a year now because I had a double lung transplant back in June 5th of 2019. So I've been practicing I wear a mask everywhere I go. I'm the only fear, and my kids, my wife, the other people in my care team, they wear masks everywhere they go. And that way I know they're not getting it. And if they're not getting, I can be around them. And that's the big issue. I've got a buddy though. I have to ask you, Renee, I got a buddy who's big in the food service business, bars especially. You just heard him, actually. He was just on at the very beginning. He's huge. He knows everybody in all these sections. He's been very perturbed because Fauci and all these other people are saying, don't go in restaurants and don't go in bars. Well, go ahead and go in Walmart. Go ahead and go to Home Depot. Go ahead and go to all these. And I walk into Home Depot one time and I'm never going back. I have my mask on. There's a ton of people without masks walking around.
Yeah.
And I'm like, what are you people doing? But the restaurants and the bars, they've done all their social well, I can't speak for all of them. I know in this area, for the most part, they're setting up outdoor stuff.
Mm-hmm.
Okay. And thankfully the government has said it's okay for the time being, you can sell to-go alcohol, which is kind of cool for the bars. It keeps them going. I don't know how it's doing for drinking and driving, but no, I'm kidding. I think it's fine. But that's one of those things that is one of these things that's just really hurting the economy, because if we would all am I right? Tell me if I'm right or wrong about this, because that's what I'm asking. It's more of a question.
There's always
if we're protecting ourselves.
Yeah, there's always going to be a balance. In any public health intervention that you can think of, there's a balance between economic considerations, personal considerations, community considerations. Think of anything. Vaccines. There's a level at which we need to vaccinate, and a level at which there's some vaccines that we don't give because it's just not economically feasible, and there's others that we give because if we didn't, the number of people who would be sick, the economy would collapse. Mm-hmm. So we got to take those considerations into the equation. The thing with restaurants and the thing with bars is not so much what the businesses do, and the businesses have been great. I see them doing all the right things. The issue is the patrons. So in a lot of cultures, and I'm from Texas, family originally from Mexico, and a lot of the Latino cultures too. We don't go to the bar just to sit there and drink. We go to socialize, right?
Yes,
and so in that socialization, we chat, we stand close to each other, we take off the mask to give the 2 kisses. We shake hands, we hug to celebrate.
You can do the 2 kisses with one mask.
Yeah, I know, right? So it's all those things that happen that the restaurant owner, the bar owner doesn't have any control over. And that's where the recommendations for less number of people, more social distancing, more control over who gets in, that comes into play. Now, we're at this phase right now in Fairfax that, yes, these things are happening and you can have outdoor settings. That's fine. When the level of disease increases, it only takes one person going into a party situation to really get everybody exposed. That person decides, no, I'm not going to wear a mask, or I'm going to be drinking so much all the time that I'm just going to take it off without even thinking. And then you have other exposures within that place, like the public restroom, the door handles, the all those things that kind of go, we don't think about it, but it happens. And so on the one hand, yes, we want to keep those places going, and they're doing great, and they're doing everything that they need to. On the other hand, humans, man, we just, we have this habit of being our own worst enemies.
We are. And, and humans in America have this sense of freedom. I shouldn't have to do what I'm told to do, because I should be free to do what I want to do. You know what, buddy? But you're not free to impose on other people, and you're imposing a disease on other people if you've got it and you're not properly taking care of yourself. The other thing that we've talked about this on this show with other people. We've had one of the nurses, maybe from, I don't know if it was from your offices or not, but we talked about the fact, and of course I get the whipping from my nurses and stuff. Back in October, it had been 6 months, maybe it was November or December. It had been 6 months, so that was one of my mileposts, as far as lung transplants concerned. So I thought, well, I'll wear my mask and I'm going to go to the rodeo. Well, when they found out I'd been at the rodeo, they were like, "Are you out of your mind?" I'm like, I wore my mask, but wearing the mask for me is a little different than wearing the mask for COVID protection. But wearing the mask, as my infectious disease doctor told me, wearing the mask is good for you. And it's also, if other people are wearing it, keeps them from infecting you.
Yeah, if everybody just decided to put on a mask today and not take it off for the next 4 to 6 weeks, you would see it. You just come to a very manageable level, and then we would stomp it out with contact case investigations and wide testing. But we have this discussion over and over again in public health that we can only nudge people towards doing the right thing. We cannot force them to do the right thing. Right. In very rare occasions, and that hasn't been the case, knock on wood, with Fairfax. In very rare occasions, a public health officer does have the authority to impose a quarantine on somebody. But we've had people who have been very cooperative here. But you talk a lot about rights, but a lot of people don't seem to talk about their responsibilities, right?
Thank you.
I as a citizen have a responsibility as well, not just the rights that are endowed upon me by my creator,
right.
or so the Constitution says, or right. The Declaration of Independence. But I have a responsibility, just like I'm supposed to take up arms to defend the country. If I can do that, why can't I put a mask on to defend the country as well? And so that's the kind of discussion that, we have every day with people who contact us and they want to know, why are you forcing me to wear a mask when I go into a restaurant?
Because to protect the other people in the restaurant.
Exactly. It's public health. It's science. It's the best thing that you can do. And it's still, we still have a lot of pushback on that. Not as much as would be troublesome, but it's certainly kind of catching our attention that yes, there's still groups of people who are pushing back, at least in this area. I know that it's a whole other conversation in other parts of the country, but at least here we have plenty of compliance and plenty of people who are willing to go that extra step.
Right. Well, I wanted to tell you that Kelly Gunderman said that she's VIP Alexandria Magazine is watching, so she wanted to say hi. Okay, so here's one of the other things that I understand is one of the deals with COVID. It's not so much passing exposure. It's not so much stopping for a couple seconds to say, "Hey, how are you?" Wearing masks, of course, no issue. But even with masks, my understanding is the longer you stand and talk to somebody. Talk to me about that.
Yeah, so the recommendation right now is no more than 15 minutes, sit within 6 feet of somebody. And
15.
So 15, 1-5, yeah.
15, okay.
And so the virus, for a virus, it's a pretty heavy virus. And so gravity takes over about 6 feet out. It can go a little more than 6 feet if you sneeze or you cough, if you yell, whatever. But on average, it's 6 feet, and it just gravity takes over, brings it down to the ground. And then when we are wearing the mask, we catch all the saliva, when you talk, or the cells that the virus is attaching to. So that's good. It doesn't catch all of it. And that's where this situation comes in, that if you're in close contact with somebody, you're wearing a mask, but you're up close within 6 feet of them, you're talking for an extended period of time, you're still, unless you're wearing like a respirator mask or something that you've been trained to wear as a healthcare provider.
A P90, whatever it is, right?
N95, yeah.
N95, I knew it was something. Yeah, N95 mask, okay.
Yeah, so, that is coming out. And the other person on the other side, they don't have eye protection. And the eyes are connected to the nose, this is all connected. It lands on your eye, it lands on your hand, and then you scratch your eye. While we've been talking, I've scratched my nose a couple of times. You scratch your nose, without thinking. And so, and so that's where the breakdown happens. So 15 minutes, 6 feet, that's kind of the recommendation. Stay away from people, don't do that. Very hard to do if you don't earn enough money to have your own car. So you're in a bus with a whole bunch of people. Very hard to do if you're on the metro. Very hard to do if you're at home and you're in a multi-generational home where you have grandma and grandpa, a couple of aunts and uncles, cousins living with you. You're sharing one or two, if you're lucky, two bathrooms. Very hard to do. And that's why we're seeing it hit the minority immigrant population so much, because they're in that situation where they need to go to work. They don't have jobs that they can do online. And then they need to ride mass transit, and they live in these crowded situations.
Sure.
But yeah, 15 minutes, 6 feet, and anything more than that begins the clock starts ticking, until you get infected.
Right. What about people, like, for instance, let's say I go somewhere and I'm wearing my mask. I'm not inhaling anything, but there's people with me I've been less than 6 feet from. They spit on me when they're talking and, that kind of stuff. Can I carry COVID on my exterior clothing into my house and get someone infected?
Not for very long. No,
Okay.
No, it really doesn't like to dry out. And so as soon as that's dry, it's gonna be very, very inactivated. You just put your clothes in the regular laundry, nothing special to do. The sunlight also seems to do a number on it. It just it dries out as well. It doesn't like it. And then, washing your hands is more than good enough. And then the other thing is, the volume. So if you're just talking to somebody, you're not going to have as much as if you're in a little bit more of an intimate setting, correct? And so that's where another problem could happen.
And that's what, I remember back in the 80s during the real big HIV scare. That was a virus also, as people know. I'm not telling you. That was a virus also. But one of the things they talked about, and again, I listen and hear things. I don't listen to mass media because they don't give you all the information. I seek out where other people are speaking, and then I try to vet it and that kind of thing. And I did the same thing. I wrote a paper about HIV and how incredible, horrible it was. And, the thing was that they talked about white blood cells carry the virus throughout your body. Mm-hmm. And so we have thousands of white blood cells in our saliva. We have thousands of white blood cells in our eyes, in the not tissue, but the liquid or the membranes in our eyes. So if you go to, like, for instance, and I don't want to put this on anybody bad, But if you go to, let's say, like you were speaking about, low income free clinic, you watch it at the dentist back in the 80s, because they didn't want to discriminate against the majority of people that were carrying the HIV. Understandable. But if you went into a dentist office who knew about HIV and how it's face shields, they had everything, mask, face shield, goggles under the face shield, because they know that they want to help their clients, their patients, but they also know it's susceptible, because one of my buddies who's a dentist, he said, inside your mouth, always going to be a sore, an open sore inside your mouth. If there were no open sores in your mouth or through your body, you could ingest the HIV and it would just go through your system, but that's not possible. I mean, you have open sores in your mouth. So I'm wondering about COVID. How does the COVID similar, I would guess?
Well, it is and it isn't. So COVID is a different kind of virus than HIV.
I understand
HIV
that.
is what we call a retrovirus. It has its own way of transmission, its own way. It also
changes constantly, right?
So HIV has been very, very stable.
Good.
It's very stable. It doesn't mutate as much. COVID does mutate. COVID is also found in a lot of different animals, and bats and cats and other kinds of animals.
I wouldn't.
Yeah, coronavirus is in camels. That's what caused the Middle Eastern respiratory syndrome. Civets, which are a small furry animal that they would sell in Southeast Asia. That's what caused the SARS epidemic back in 2002, 2003.
Right.
So it's different in that way. As far as how it transmits, it transmits just like the common cold. In fact, there's 4 coronaviruses that cause the common cold that we know for sure cause the common cold.
Correct.
So everything that prevents the common cold prevents this coronavirus as well. Hand washing, staying home if you're sick so you don't give it to somebody else, wearing the mask, staying away from people who are sick. What threw the wrench into this whole thing is the asymptomatic transmission. That really made everybody because at the beginning, even I made the mistake. Well, I don't have
a fever.
Yeah, fever, cough, sore throat, and we were saying, you don't need to go out and buy a mask because it doesn't protect you. And then we found out, oh my God, 1/5 to 2/5 of the population who get it are asymptomatic. Right. Everybody slap on your mask, and people like Dr. Fauci and others are getting heat over that. But at the time, it was the right call. Now that we know this, we changed, and that's the thing, man. That's the thing about science. We always are open to the new information and changing our thinking and changing our recommendations. And some people will take that as, oh, you don't know what you're doing. Look at how many times you've changed. Whereas others are like, oh, you must know what you're doing because you're changing with the new evidence that you're getting.
Right.
So
exactly.
That's where we are.
Yeah. It's like, dude, I'm an epidemiologist. Okay. I'm not a pediatrician. I'm not, I'm studying how this virus moves and shakes and gets where it's going. And that's why when we discover, oh, that's one way they can get it that we didn't know you could get it, then we implement what the safety is to protect yourself.
And we had to do it. We had to do it in real time. We had to do it in an emergency basis, getting data from unreliable sources, getting data from some guy who saw 15 patients in some clinic in Korea. And he wrote it up. Oh, that's interesting, and we need to look further into that. And so that's where we find ourselves. And I think that feeds the conspiracy theories. That feeds the mistrust. But when you step back and look at it, it's like, oh no, you're right. You're actually going with the best evidence at the time that you're making these recommendations.
Right. And so now, since people can't call Dr. Renee Najera every day, are the where's the best place to look? CDC's website, Johns Hopkins website.
Johns Hopkins is good. The World Health Organization is good. Your state and local health departments are good. I know here in Fairfax, our website, we update it every single day with as much information as we can. Where do
you get your information, though? Do you get yours from CDC? For
more global evidence, more global things, CDC, World Health Organization. For evidence about best practices, the Virginia Department of Health And ourselves, we're always reading papers. We're always reading the latest journals, just keeping up with that, getting online and having conferences with colleagues and getting that information. And then as far as the information on cases and all of that, we have a lot of surveillance systems. So we're always keeping track of who's in the hospital and for what, who's being tested and for what are the results. And then the contact case investigation that is going on, where we contact the cases and we see where have you been, what have you been doing, who have been your contacts, and so we kind of understand the dynamics of the disease that way too.
Sure. Yeah, I'm on my way. I don't know what day. I have a endoscopy appointment that's just regular, for me, on September 1st. And I have to get the COVID test before they'll do the endoscopy. So I've got the call in. They're going to give me a time. It has to be within 76 hours, whatever, something like that. So will be interesting. I was offered the COVID test when I went to do my blood work one time. And I was like, no, I'm okay. Because I haven't really had any, I've been very careful about exposure. But I kick myself a little bit. I'm like, well, maybe I should have, And so I'm looking forward kind of to doing just to get that, even though I'm not looking forward to that thing up in my sinus cavity. I worked at the Senate when anthrax hit Tom Dash's office, and I was on that elevator, so I had to have scramble my brains, and they put me on Cipro for like I don't know how long. Maybe that's what caused all the lung issues.
I
don't know. Anyway, but listen, Renee, I want to thank you so much. We're going to have you back on because as things change, as things move up and down, hopefully, we can get some insight from you if you don't mind, and we'll give you a holler, and we'll have you back on.
If you want to talk about anything else that comes upon the people, that's what
well,
we're here.
I want to talk about HPV one day, but that's an old, long, another thing that I want to talk about. That's just personal, information, because I want to see from 20 years ago when it was first kind of coming into being, well, more than 20, about 30 years ago, that it was first starting to be named and whatever. I want to know more about where we are now, 30 years later.
Now,
but not today.
But if you really want to have fun, let's talk vaccines. That'll really
I'm all about, and you said some are more like the malaria vaccine. Is that an expensive vaccine?
Well,
but you don't need it here.
We don't need it.
But if you're going overseas, to certain places,
measles, mumps, rubella, the ones for children, the HPV one for teenagers and adults, those we need. But there's some that we keep them for when you're traveling. We keep them for if you're working in a specific line of work, like the smallpox vaccine, for the military. But other than that, the childhood ones and the ones that we as adults need, and you as a transplant recipient, everybody, I hope everybody around you is cocooning you by getting their own
flu vaccine and we are. So that's in the pneumococcal whatever vaccine also. And that's actually about due for that heading into the cold season. Cold flu and COVID season.
Yeah, when we have the COVID vaccine, that'll be an interesting exercise in mass vaccination. We're going to try to vaccinate millions at a time. So
well, we'll definitely. I'm sure my infectious disease doctors will keep an eye on that, wondering whether or not I should get that or not right away, or wait for it to show some more, like what you do, see how things happen from it. Because obviously we don't want to. I have never felt better in my life, and I'm blessed to have gotten 2 new lungs, and blessed that Dr. Linda Bogar did the surgery, because she's the best. I've been blessed, man. That's all I can say. Blessed, because I'm part of these outfits and talk about transplant, and some people are not doing well. They told so anyway, but Renee, thank you so much for coming on the program. Ladies and gentlemen, Dr. Najera, and we will have you back on. We're at the end of our time. I appreciate you.
No problem. Thank you.
I appreciate you coming on. Thanks, man. I appreciate it. Thanks. All right, guys, I will stay healthy. Thank you, Dr. Najera. My boys, Billy Riley, I don't know who was supposed to join in. Hi, Carrie Crawford. She joined in also. Kelly Gunderman was watching and excited. she's going to be boycotting the NFL, I guess. Billy Riley was going to chime in here at the end of this program so we could talk about tonight. Tonight's show is going to be fantastic. It's the Love Hacks Show. MoreJoy Media presents the Love Hacks Show. We're going to be talking about the first date went great. Now what? So that's on the dating show, the Love Hacks. It's a one-of-a-kind kind of program, especially because of the three people who collaborate to make the show happen. Myself, Lisa Marie, and Ramrod, Billy Riley, who is our definitely, he's got a lot to say tonight. He's already gearing up, folks. So it'll be a lot of fun. I hope that you have a chance to tune in. I don't know. Let me try and contact that guy and see if he wants to join us here at the end so we can chit-chat with him. Want to come on? And I'll stay even though we're going overtime a little bit to come on. And I don't talk in text very well, as you guys know. So we'll take a quick little break. I'll play a couple, put up a couple of commercials and promos, and then hopefully my man Billy Riley will join back in with us here momentarily. We'll be right back. Well, everybody, I don't know. He's probably busy chatting up somebody and not hearing his phone, but that's okay. We will go ahead and bump off here. And when we come back, we will come back at 7 o'clock tonight for MoreJoy Media presents Love Hacks. So Kelly Gunderman, I don't know if she was watching, but yeah, Love Hacks, great show, wonderful show. Hope you have an opportunity to join us tonight at 7 p.m. Wherever you're watching right now, you can watch tonight at 7 p.m. in the same place. Don't worry. Be happy. Be fun. Come join us. The subject and topic for tonight is going to be, well, the first date was great. What now? So that's a lot of people want to know that kind of answer. What do you do after that first date? I mean, you know, this close to getting a kiss and had a great time, good conversation, and good night, take care, you know, maybe a hug, bye, see you later. And then they go in their house and you walk to your car and you go, when do I call him? When do I text to tell her how much fun I had? You know, I think you just, on the way back to the car, thanks a lot. Tonight was great. Done. Hit me up when you get a chance. You know, done. You like that? And that's what we're doing. All right, ladies and gentlemen. I don't know where my main man, Billy Riley, is, but thank you for watching today.